Thanks for the opportunity to speak to you today. Fascinating. That's not one word I hear very often, and
I love that word.
I did my PhD in economics, and I often joke in my house when we're looking for a doctor, I say, I'm it, but my wife says, you don't count. And she's right. So, as Lucas indicated, I'll be talking to you today about One Health as a concept and as a communications platform. It's obviously not a new concept, but I think it is a concept that is evolving, and I'd like to share with you some of my reflections on that evolution. And I think the timing is right for us, for the animal agriculture sector, for the ag industry in general. And a lot of that came to bear, I think, at some of the morning sessions here. This is a great quote by Peter Drucker, which I think is very fitting for our industry. The greatest danger in times of turbulence is not the turbulence. It is to act with yesterday's logic. And I think it's pointing towards looking at the problems of today, but looking at solutions for tomorrow. It's a pivotal time for our business. It's a pivotal time for animal agriculture. And it's a pivotal time for the hundreds of millions of people that depend on animal protein to support their livelihoods in the emerging economies, but also globally to support nutrition worldwide. And I think the concept of One Health allows us to forge a vision for the future of agriculture and for the future of global protein. So I've been traveling quite a lot these last few months, and I'd like to share with you some of my reflections as I've talked to others about what One Health is, and as well as talk about what One Health is and how we can leverage it within our industry. And I think there's a critical window of opportunity here that our industry is being offered. And we touched on some of these this morning in some of the morning presentations, and I think this came across very clearly in Professor Southgate's presentation, is that protein is it is the number one food segment by growth. And if you look at current demand levels and what's projected out to 2050, what's clear to me is that no food group will have a greater impact than protein in the coming decades. And not just for the emerging class, we talked quite a bit about that this morning, but also for the affluent as well. It's no surprise that protein snacking is one of the hottest trends today. Carbs and sugar continue to be vilified, fairly or not. And what seems clear to nutritionists is that protein is key to addressing the obesity epidemic in affluent society. And I think a good example of this from a product level is Fairlife's high-protein milk product, which is amongst one of the hottest new brands in dairy and in beverages more generally, driving 4% annual sales growth for Coca-Cola North America, and that's in the midst of a carbonated beverage industry that's continued to see decades-long declines. Secondly, I think this window of opportunity we have is that food has never been more personal. We are very fortunate to live in an age where we are increasingly buying food not to fill a need, but to fill a desire. And where we go to eat, the choices we make about our food and our brands, particularly with the younger generations, continue to define their values, their personality, and who they define themselves as an individual. Thirdly, I think One Health offers a window of opportunity around the global connectivity around food, and that connectivity around food and health in particular, which is growing. And I think One Health historically had a big focus in diseases, specifically zoonotic diseases, but I think One Health is becoming much more than that as a platform. It's about the connection between food, health, animals, people, and planet around the world. And lastly, I think there's a window of opportunity as the recognition on the importance of supporting good animal welfare and sustainable outcomes with respect to agriculture and animal agriculture in particular. I think there's three catalysts for this window of opportunity that I'd like to share with you. I think the first one is the opportunity and the catalyst that One Health offers to elevate the dialogue that we have. And that dialogue is not just an industry-to-industry dialogue, ag to ag or producer to producer. But I think more importantly, the dialogue that takes place between agriculture and consumers, between agriculturalists and those that increasingly do not understand production agriculture or show an unwillingness to understand. I think it's the right platform to put the health of the animal right at the table, changing the conversation and repositioning the animal protein discussion as animal protein as a vital solution. And I think One Health also offers a platform to evaluate and solve the issues that we currently face, and you could take your pick there. I think antimicrobial resistance is probably one of the most compelling and one of the most important ones that we face as a society today. Simply put, I think healthy animals have a better quality of life for themselves. Healthy animals tend to be more efficient and more productive, and they are providing more sustainable solutions when it comes to sustainability and environmental stewardship, and also provide nutrition for healthy people. Secondly, the second catalyst is the need to stimulate innovation. Why do we need innovation and how we can stimulate it? I think One Health offers answers to that question. We know our industry is the beneficiary of a number of trends. The increasing productivity that we've witnessed and achieved as an industry is quite remarkable over the last 50 some odd years. But to capitalize on this and other positive trends, we have to address a number of brutal facts, a number of brutal realities, which I'll address in a moment. But amongst them, I think, is including concerns in how we address so-called clean food, the increasing free-from food movement, gluten-free, sugar-free, fat-free, nitrate-free, hormone-free, soon it will be DNA-free, how we treat animals, and whether our practices harm the environment. These are tough questions, and I think we need to address them. And lastly, I think the third catalyst is driving influence, specifically in the food chain. We can bring innovation to ensure healthy, efficient animals while still giving affluent consumers the choices they want. But what is imperative is that we do not get ahead of the science. We need to understand what's driving these changes and how we can address them and make sure that appropriate solutions are in place before we enact policies prior to those solutions. So what is One Health? I said it, but I think it's worth repeating. Healthy animals have a better life for themselves, a better quality of life, are more productive, are more sustainable, and are critical to providing for healthy people and a healthy planet. So why One Health? Why One Health is the platform? It is a way to take what I believe is a complex and disconnected story about humans, animals, the environment, and offers an opportunity to make that clear and connected. We've heard others talk about One Health, I think, at this event and many other events. But I think this platform is critical. And as I mentioned, it's so much more than disease spread. It's so much more than zoonotic diseases. It's this broader context that offers a way to make what's relevant and relatable to the consumer and to those that do not work in agriculture. Healthy, efficient animals impact healthy people and support a healthy environment. They make meat, milk, and eggs more available to nourish people. And as we know, protein is a very important part of a balanced diet. It strengthens the body and the mind and can limit malnutrition, obesity, diabetes, and other diseases. Healthy animals are more efficient and more productive and help conserve natural resources and help reduce emissions, sustaining an environment. What we do, I think, in agriculture touches not just some individuals. We all eat. And I think touches every person every day. Every day at dinner tables around the world, people experience the outcome of what we in agriculture do. And I think One Health offers an opportunity to communicate the importance of that. So what are the brutal realities and facts that I mentioned? They begin with numbers that I think everyone in this room is familiar with. 1 in 3, 60%, 20%, and 1.6, and I'll unpack those. 1 in 3 people today get the wrong nutrition globally. This includes the 800 million that are malnourished in some of the least developed countries, and also includes the nearly 2 billion that, according to some estimates, are either overweight or obese. Animal protein is critical to balancing diets and help managing weight, lowering the prevalence of obesity, and supporting and reducing malnutrition. 60%. We saw and discussed today growing global production in middle class as well as protein diet trends in the developed world will drive a 60% increase in demand for animal products in the next 35 years. That's remarkable. The most affordable proteins, eggs, milk, and poultry, are already exceeding projected growth by 7%. 20%. 20% of animal productivity is lost to morbidity and mortality globally. This is the greatest untold story of food waste, I think. Animal health and the optimization of the animal is challenged, and in some cases it's not getting better, depending on the area of the world that you're looking at. 1.6. That's the number of Earths we're using in a year. By August 8th of last year, we used all the resources that should have lasted the full year. And this date is going further and further in time. Animal productivity is key, but it is not keeping pace. And we have to address this fact. Healthy animals are under constant threat. We know that healthy animals that are well cared for have good quality lives. They reduce disease spread between animals and humans and help support the production of nutrient-rich meat, milk, and eggs more available. However, regardless of the production system that you look at and how animals are raised, they are always going to face chronic health challenges. Here are some. 3 in 4 beef cattle face bovine respiratory disease, causing pneumonia. 1 in 4 dairy cattle face mastitis, an infection of the udder. 1 in 3 swine herds are affected by ileitis, a gastrointestinal disease causing diarrhea, anemia, and other issues. And 1 in 3 chickens face coccidiosis, a common parasite that causes diarrhea, dehydration, stunted growth, and death if untreated. And beyond the farm, zoonotic diseases such as avian influenza pose a serious risk. If we look at the 2015 HPAI outbreak, for example, 7.8 million turkeys and 40 million layer hens were lost in the United States alone, representing 2 and 4% of the animal population in the U.S. This is a tremendous animal welfare issue. But there's also the One Health component of this as well. If we look at those lost turkey numbers, we lost nearly 90,000 metric tons of turkey meat, representing 46 million Thanksgiving dinners, 195 million turkey sandwiches, 113 million turkey burgers, and resulting in a cost increase of around 25 cents per pound. In terms of the layer population, the loss of those layers resulted in over 12 billion eggs lost at a cost impact of 42 to 47 cents per dozen. And layer hens are also an important source of meat as well, a lot of them going into chicken soup, for example. We lost nearly 65,000 metric tons of poultry meat, resulting in about 2.2 billion servings of chicken soup that did not get provided. And those birds were raised to some point before their lives were lost, based on the average amount of feed consumed. 220,000 acres of corn and soybean were lost, and 474 million gallons of water based on the average water intake, representing an annual use to support 467,000 households in the U.S. This is a tremendous, tremendous loss. And it's not just diseases, but production practices as well. Cage-free is a very good example. Right now, there are 16 million cage-free layers in the United States. Policies moving faster than the science are going to drive the need for cage-free layers up to 190 million by 2025. The conversion costs for this are estimated at $6 billion, and that estimate continues to rise. The average price difference between conventional versus cage-free eggs, around 90 cents versus $2.79 per dozen, represents a clear challenge for some households who still in the U.S. face issues around food insecurity. And what makes this even more compelling is that there is a market glut for selling cage-free eggs. Many of them are being sold as conventional because there is not enough demand to support their retail value as cage-free. There's a need to stimulate innovation. Innovation is plentiful, rewarded, and can meet consumer expectations. I think it's clear innovation in animal health is abundant today, Fortunately, we are in an industry where innovation is also rewarded. But I think if I reflect on the current state of innovation, I come back to the point about we can't get ahead of the science. We need to constantly look at sustainability as a journey and not a destination, and continuously improve sustainable outcomes, improve efficiency, leading to more supply of protein to meet growing demands. And we need to do this through more productivity, not through adding more animals. That is not a sustainable option. There are often decisions being made at the retail level, some pushed by activist agendas, that are moving faster than the science. These decisions are often decreasing efficiency and ultimately decreasing the sustainability of our industry. As I mentioned, we cannot continue to meet demand by adding more animals. Animal disease is and will continue to be a significant challenge. We will continue to need tools such as antibiotics to provide appropriate health care to animals, but we will also need alternatives. This is one element of the innovation that I think we need to focus on. There are a number of disease threats today that simply have no other alternatives, however. Here is information from the OIE that has identified 18 priority pathogens in pork and poultry that must be addressed if we're to achieve our goals of reducing the need for antibiotics in livestock. But we're also going to need new tools that increase efficiency, increase sustainability of production, and increase the animal welfare outcomes for the individual animal while also meeting consumer expectations. Here's a very good example. Take dairy for example. The chart on the left breaks down the supply of milk by increased milk per cow, that's productivity, increased cows, that's adding more animals, and the interaction between the two. The interaction is a small segment where you get both, more cows, but they're producing more cow than the previous generation. And this is broken down between 1961 and 2010 versus what's trending between 2007 versus estimates up to 2020. I think the important point here is that innovation is not only critical in supporting animal health, but in improving sustainability and efficiency of our industry. In the last decade, just 3% of the increased milk supply globally has come from improving productivity. 82% has come from adding more animals. And you see this in the global dairy charts on the right, where the milk supply in blue against the red line, which indicates the number of cows, and the green line, which indicates average milk per cow. And this is the same in every industry. In eggs and beef, we're actually going backward. Poultry is the only species globally that has significantly improved, and yet we now have activists talking about things such as slower growing chickens, literally turning back the genetic clock. Food chain influence. I firmly believe we have the innovation we need to meet future demands for protein while still giving affluent consumers what they want. But we must understand who's really driving these changes. We have to stop differentiating on the negatives and focus on the positives. And we need to understand what the consumer wants. I think there are 3 metrics to truly understand and help support our understanding of what the consumer wants. The first is identifying headlines versus social media mentions. Media headlines, such as in the news, are used to drive changes to supply chains, and we see these by commitments made across the retail supply chain. But we now have the technology, through social listening, to assess whether or not and determine if consumers are really interested in that headline or topic, or are they just talking about it, or are they talking about it in their circles, or is it a non-issue? The second one is aided versus unaided questions. If you ask a consumer, are you concerned about antibiotics in your food, they will unequivocally say yes. If you ask consumers, what is it that's important to you when you buy meat, they will consistently say amongst the top 3 is price, taste, and quality or nutrition. The third one are call line inquiries versus actual spend on data. And the key here is how do we differentiate if a call line inquiry is driven by activists versus consumer concern? The proposition in California and all the polling went on indicated that consumers supported cage-free eggs, that they wanted it. But when it came time to vote with their wallet in the grocery store, they did not. Taste, cost, nutrition still drive more than 90% of consumer choices. Here's a history In recent years, negative labeling claims have accelerated, taking tools and innovation away from producers at an alarming rate, to the extent that new innovation is no longer able to fill that gap, moving from irradiation, hormone-free, gluten-free, antibiotic-free to some of the more recent ones that are out there, slow-growing chickens, GMO-free protein, and one that I could easily foresee is vaccine-free protein. We're seeing efficiency and sustainability stagnate and move backward, also jeopardizing animal welfare. Ultimately, all the negatives used to drive short-term marketing differentiation have eroded consumer trust and confidence in the process. And as I reflect on this, the question that compels me is, what if we change the game as an industry? What if yes becomes the new no? Instead of focusing on free from and negative labeling, what if we pivot to the positive? More protein, improved welfare, more sustainability. Remember the Fairlife example, one of the fastest growing new brands in the US today, and it's all focused on positive labeling. More protein, more calcium, more sustainability, more taste, delicious. This is a bit of an eye chart. I'll unpack this. This has been presented at some different events based on some work that I've looked at on the impacts of raising broilers without antibiotics in the U.S. That top left chart represents the supply shift that's occurred over time. The red line indicates the volume produced in terms of share of production under no antibiotics ever. Raised without antibiotics, also known as antibiotic-free. And we've seen that come from a niche market back in the late 2000s, 2012, 2013, to quickly accelerating to a significant share of the market. But we all know we don't raise boneless, skinless breasts, we raise whole birds. And what's produced as NAE is not necessarily sold as NAE. In the U.S., we are a white, boneless, skinless breast market, and there are labels on that share, that cut of meat. But what about antibiotic-free wings, thighs, legs? There's not a significant market for that, and a lot of that is also exported. So what is raised as NAE, most of it is not sold as NAE. The chart on the right in green represents the premiums to producers for producing NAE. It's more costly for a number of reasons: more downtime, more days to grow out, higher density, reduced feed conversion in some cases, and of course facing disease challenges. But we've seen that, and this is classic supply and demand, as the supply of NAE meat continues to saturate the market, producer premiums continue to erode over time. And while it's not quite clear in that bottom chart in blue, this is data coming out of AgriStats. What we're starting to see in the most recent year or two in mortality in the broiler industry is going against decades-long trends of declines. We're actually starting to see average mortality rate in broilers increase, albeit ever so slightly. And Elanco has a social media monitoring, and we monitor a number of different topics, but antibiotics is one of them. And as you can see in that bottom right chart, what consumers are talking about in the social media space when it comes to broilers is taste, price, nutrition. There's some labeling, and of course you would expect some avian influenza, but when it comes to the social media conversations, they are not talking about antibiotics. These types of negative claims are not good for producers, they are not good for animals, and they are also not good for our planet, and frankly they aren't good for the consumers either. Again, we have to stop letting policies get ahead of the science. New innovation and alternatives will come if we support them and if we allow them enough time. So here's the example of pivoting that, of changing the conversation from free from and negative to positive. Here's Fairlife as an example of that. Their labeling is centered on more protein, better animal care, more sustainable, more economical. I think if we pivot the conversation to the positive, that will resonate. Positive stories are more compelling. So as I reflect on One Health and I think what it can do for our industry, there are a number of things that I would like to emphasize. One, I think One Health offers the opportunity to elevate the dialogue as a positive platform that brings more credibility and more connections. One Health enables this conversation. It connects us to the bigger issues of humans and environmental health and bigger stages where we haven't been before in agriculture. I also think it strengthens our credibility and our linkages, as well as prevents one-dimensional decisions that seem to be taking place. It also gives us a framework to influence challenges to innovation and choice, and allows us as an industry to bring a deeper, broader following with us. Fundamentally, I think the important point that I'd like to communicate today is that we have to stop the negatives that are driving choices out of our food system. Innovation is the solution, not more animals. And we have to base our decisions on what the consumer wants, but who's really driving these decisions? That is the question we have to ask ourselves. Is it the consumer or is it the marketer? And we must not let policies get ahead of the science and the new innovation that's coming.